Well, the past few months certainly have felt a lot like spring, even summer sometimes here in Colorado, even though we're in winter time. But just because we haven't had snow does not mean we have not had winter illnesses. The current flu and cold season has been incredibly brutal, some of the highest rates of doctor visits for flu symptoms since the 90s. And things have been really rough here in Colorado. We've even had 4 children die from flu-related illnesses this winter. So joining me today to have a deeper dive on this year's flu and cold season, plus tips about how we can stay healthy, I have Dr. Mark Montano, Medical Director of HCA Health One's Urgent Cares, Care Now Urgent Cares. Thanks for coming. Urgent Care, that's like everyone's first stop when they don't feel good.
Well, and we like that.
Yeah, tell me a little bit about just like what you guys, as far as busyness this season, you've probably been just flooded, feels like a dramatic word, but is that a fair word?
You know, that really is. And I think as we were going into the flu season, we thought it was going to be an average year. And November and December hit and we realized how wrong we were. This was one of our busiest flu seasons in decades, as you had mentioned. And we really hit those numbers pretty early in the flu season. Like I was saying, in December, we were in the very high as far as number of cases in Colorado.
Tell me, I'm thinking a lot of times people go to urgent care before they know they definitely have flu. This year's flu strain, what is it about this thing that makes it so tough? And how is it holding up against people who are getting vaccines?
So, well, the vaccine gives some protection, and vaccines are really made to decrease the severity of the illness, not prevent it 100%.
And is it helping with decreasing
it does. We
good.
see that people aren't as sick. As far as why is this season worse, one, it was a relatively new strain that came around, and that's one of the reasons that our predictions were wrong. And we also
don't we predict? Sorry to interrupt you.
No,
don't
no.
we predict based on other hemispheres and other areas?
Right.
It's really just a best guess every year.
Exactly,
which is tough.
And our flu vaccines are built based on what's going around in other parts of the country, and we say, well, based on that, we think these strains will be in circulating in the U.S. When they come through flu season for us.
Yeah, that's tough every year, I'm sure.
Yeah. But this year's flu vaccine did have quite a few GI symptoms. So not only did you have the cough, congestion, runny nose, the shortness of breath, but you also had the nausea, vomiting, and diarrhea. And you add those two, more dehydration, people just feel worse. And we think that's why there were more visits, not only to the urgent care, but to the ER. People were just really having a hard time getting over this year's influenza.
Yeah, and we talk about stats. I had read that Colorado had it really rough. Kids have had it really rough this year. It's has it felt that way? Working in the urgent cares, like it does feel like the data is matching what you see every day.
Oh, we are definitely seeing that. We'll see a mom or a dad a guardian bring in their child, come in for themselves, and then a week later, 2 or 3 of the family members come in. So it is hitting one person, and then like dominoes, they all get sick.
Yeah, and if anybody's office is like our office, you just have the people getting sick, call-outs left and right every day.
Yeah.
Let's talk about risk factors for flu. We always hear about the littlest and the oldest being the most vulnerable.
Yep, and that's the same this year. People who immune system may not be as mature, or maybe their immune system is not as strong as it was when they were younger. So those definitely are patients that we have to keep an eye on. And then anybody with comorbid conditions, so people with cardiac disease, asthma, diabetes, they tend to be hit a little harder. Yeah, and we are definitely recommending receiving the influenza vaccine now. Even as we move into March, we're saying, yep, if you have risk factors, it will protect you. It takes a couple of weeks for full effectiveness, but we're not saying, oh, we're over the flu season, you're good to go till next year. We're saying get your flu vaccine, and that should get you through the end of flu season, which can last through April.
Okay, so not too late.
Not too late.
Is there anything you can even really do for someone with flu at this point? Is it fluids? You hear things about over-the-counter meds or Tamiflu. Is that real? Can we debunk a little bit here?
Yeah, good question. Well, Tamiflu does work, but it only works if you come in very early in the course of the illness. So within 48 hours, and not everybody is a candidate for the Tamiflu, partly because if you're healthy and relatively young, meaning 20s, 30s, 40s, generally you fight the flu bug fairly well. We might give it to somebody again with one of those comorbidities that we discussed earlier. But the things that you can do are things that we tell for any illness: rest, fluids, lots of hand washing. don't go around people who may be susceptible to the disease. And if you're having any difficulty breathing, shortness of breath, or symptoms that just aren't fitting with what you think influenza should, we want you to be seen at the urgent care, your primary care. Definitely shortness of breath may be an ER condition.
Okay, take it seriously, guys.
Yep.
Dr. Montana, thank you. Good luck riding out the flu season. All of you healthcare workers too, stay safe, okay?
Thank you, appreciate it.